Hi, everyone. Welcome to the Louisiana Department of Health Services for People with Disabilities during the pandemic, a session of the Governor's Office of Disability Affairs Conference. I'm going to start off by introducing our panelists. I'm going to stop this sharing, and I'll ask each person as I call your name if you would just show your screen, your video, so that people know who I'm talking about. So I'll start off with Dr. Patti Barovechio. You have a difficult name like me. Barovechio is a statewide RN consultant with the Bureau of Family Health in the Office of Public Health. Next, we have Jana Broussard, who is the Interim Director of the Louisiana Commission for the Deaf. Hi, Jana. Next, we have Susan Meyers, Attorney Susan Meyers, who is a program manager with Medicaid Waiver and Supports. Next, we have Dr. Ashley Jefferson, who is the Chief of Staff for the Office of Behavioral Health. And next, we have Robin Wagner, who is the, who is the Deputy Assistant Secretary for the Office of Aging and Adult Services. And lastly, we have Julie Foster Hagan, who is the Assistant Secretary for the Office for Citizens with Developmental Disabilities. And I appreciate all of these ladies sharing with us about services during the pandemic, and just for being a great resource and always open to supporting people with disabilities in our state. So without further ado, I will turn it over to you ladies to for your presentation.
Well, I'm Patti Barovechio, and the statewide nurse consultant with the Bureau of Family Health Children and Youth with Special Healthcare Needs program. We really appreciate the opportunity to provide updates on our services. The Bureau of Family Health is under the Office of Public Health, and our mission is to protect and promote the health and wellness of all individuals and communities in Louisiana. We accomplish this through education, promotion of healthy lifestyles, preventing disease and injury, enforcing regulations that protect the environment, sharing vital information, and assuring preventative services to uninsured and underserved individuals and families. If you look on your screen now, those are the links to our pages where you can find intensive information about our programs. I'm going to start us off on talking about some of the available services and resources through the Children and Youth with Special Healthcare Needs program. First, we have Children's Special Health Services subspecialty clinics in the parish health units. We have supported services for CYS children and youth with special healthcare needs and their families. We also have the genetic disease program, which provides health services to families who have or who are at risk for genetic diseases. We also do the Louisiana Birth Defects Monitoring Network Surveillance Program, the Newborn Screening Program, which is your heel stick for testing for genetic diseases. We do the Early Hearing Detection and Intervention Program, which is includes the Newborn Hearing Screen Program, and the Louisiana Sickle Cell Commission. I'm now going to turn it over to Jana Broussard so she can share with you information on the Commission for the Deaf.
Hi, good afternoon. I appreciate this opportunity to share with you today. As stated, I'm Jana Broussard, Interim Director for the Louisiana Commission for the Deaf. Approximately 7% of Louisianians are currently diagnosed with deafness or difficulty hearing. LCD was established by Act 629 of the 1980 Louisiana Legislative Session, and strives to provide people who are deaf, deafblind, and hard of hearing, and those with speech disorders with programs and services to help them access and navigate the world around them. We seek to allow everyone the opportunity to communicate fully, regardless of their hearing, vision, or speech-related abilities. Our goals are to improve access to needed communication supports, and enable the people in our society to reach their fullest potential. In light of these goals, LCD has established 4 main programs, which are listed on the slide above. First, we have our telecommunications program. This program provides amplified equipment and alert systems at no cost to eligible individuals, We also have a hearing aid program, which provides aids to low-income Louisiana individuals over the age of 50. We also provide limited interpreting services, which provide communication access to state, local agencies, and businesses, etc., in accordance with the Americans with Disabilities Act. Our last program is our support service provider program. These are trained guides who work one-on-one with those who are both deaf and blind. Louisiana is home to the largest deafblind population per capita in the United States and second largest population in the world. This program provides guides that offer visual and auditory information for individuals who are deafblind, which empowers them to fully participate in their communities. Julie, if you'll go to the next slide. All right, thank you. So in light of COVID-19, there has been some specific changes and modifications to some of our programs, some of which were very minor in nature. For example, we had to do some electronic applications rather than face-to-face applications for some of our programs. But some of the most important modifications we've made have come as requests directly from the community, from the deaf, deafblind, and hard of hearing community. In response, we've provided a COVID-19 link on our website. A few of the, little bit of the information that's listed on our website is here on this slide that in front of you. First of which is video remote interpreting guidance. In regards to telehealth and other communication needs with the limitations of in-person appointments, specific guidance was requested on how to request an interpreter and establish an interpreter via telehealth. That information is on our website. We also worked with the Louisiana Department of Health to create this communication guide, which you can see on the right-hand side of the slide. And this assists with deaf, deafblind, and hard of hearing individuals when they go in for testing. So for example, perhaps they do need some accommodations or communication support. And perhaps at that moment it is not available. This communication card has visual pictures that can be referred to help with some of the pre-screening questions, This pamphlet can be downloaded and printed from our website. And for your convenience, on the back-hand side is a list of all the interpreting agencies statewide. So you can refer to the ones in your region in case you need to set up an interpreter for those who utilize American Sign Language. We also have provided links to national and local information available in American Sign Language. We have had some of the most critical information translated and posted on our website for those who use American Sign Language as their native language. And specifically, our last thing is we have provided written transcripts of all Governor Edwards' speeches. This request came directly from our deafblind community. They notified us of an inaccessibility to some of the information that was being offered by Governor Edwards and some local leadership. And we have provided transcripts which have been posted on our website. This has really been a great opportunity to provide this critical information because now it's accessible to the deafblind as the information can be converted into Braille or large text as needed. Since March 12th, when we created this link on our website, we have had 580 total views by 482 people, with an average of almost 3 minutes per view. This data supports our efforts, so this information was very much needed and is being used regularly. So we just want to say thank you for all of the feedback from our deaf, deafblind, and hard of hearing communities. We are continuously working to improve and support communication access for all of you. If anyone needs any additional information, please feel free to visit our website, and I will go ahead and link it in the chat box for you now. Patti?
Jana, before we move on, we had a question on YouTube,
Okay.
which is, are LGEs, which is our local government entities, able to use the interpreter services? And there's a and is there a cost associated with the services?
Okay, can you repeat that one more time? So they're asking at the local level if they can utilize these services. Am I understanding that correctly?
Yes, for the human service district. So I think the answer to it is any government entity has the responsibility to make it accessible if they get the request, right? But they could reach out to the commission to request like a list of certified interpreters, that type of thing, and then they do contracts.
Yes, yeah, we definitely can be a resource for any local entity. There are some businesses that may not, that the Americans with Disabilities Act may not apply to. In those cases, the commission may be able to step in and fill in that gap. But on a larger scale, typically government entities are responsible for providing the interpreting services and the responsibility of the cost as well.
Thank you.
You're welcome. Okay, if that's it, then I'll pass this over to Patti so she can continue on her end. Thank you.
So in response to the COVID-19, we've had some changes to our services at the public health unit. The subspecialty clinics almost seamlessly transitioned to telehealth services in response to the pandemic. Through coordination with regional leadership and in alignment with state guidance, in-person visits were resumed in July for those specialties that could not be effectively supported through telehealth visits. In various regions, ophthalmology, otology, orthopedics, audiology, sickle cell, and cardiology clinics resumed in-person services. In August, cleft lip and palate, along with the plastics clinic, will resume in-person services as well. Neurology, neurosurgery, genetics continue telehealth visits throughout. In response to the pandemic, the parent liaison staff that historically supported the Children's Special Health Services Clinic were shifted under the Regional Family Helping Families organization. COVID presented the unexpected opportunity to consider how to best serve as many families as possible, those who have been served traditionally at the Office of Public Health, Children's Special Health Services clinics, and the many thousands more in the Families Helping Families service areas. We know that in Louisiana, we have well over 263,000 children and youth that are identified with a special healthcare need, and that's about 23.7% of our population. That is statistically significantly higher than the national average, which is at 18.5%. So it's really essential that we ensure that our services are accessible to our families in the community. So any family needing peer support, resource linkage, community resource specialist services can contact their Families Helping Families within the region where they are domiciled. Another CV-19 transition is the BFH Family Resource Center. Until March of 2020, the center was located on the campus of Children's Hospital in New Orleans, Louisiana. And in response to the pandemic, the Family Resource Center has transitioned to a statewide virtual resource hub and is available to support all families of children and youth with special healthcare needs and healthcare providers with resource identification and linkage and system navigation services. This resource hub is staffed by a public health nurse, a social service counselor, and a family consultant. Anyone can reach out to the center via the email at that is on your screen, which is bfh-familyresourcecenter.gov at louisiana.gov. I'm sorry. And that concludes our updates, and thank you for this time.
Okay, I'll get started on the Medicaid portion. My name is Susan Meyers, and I am with the state Department of Medicaid in the Program Supports and Waivers Division. So I wanted to go through a little bit of Medicaid basics for you all, just to go over, kind of give a general overview. Medicaid provides publicly funded health coverage for low-income people. Prior to the ACA, there were sort of specific pathways for people to gain coverage to Medicaid. The ACA allowed for Medicaid expansion and coverage of people just on the basis of low income. But those other pathways still exist. There are still programs and services that are designed specifically for people with disabilities and seniors. And so those pathways still exist. And there are in addition to that, income requirements for people with disabilities and seniors. So both of those things tie together. Medicaid is funded through federal and state funding. There's a largely federal contribution with a state match for all of the services that are provided by Medicaid. And just wanted to note that the name of Medicaid in Louisiana is technically Bureau of Health Services Financing. That's the name of the entity within the Louisiana Department of Health that oversees Medicaid. So if you see that, Bureau of Health Services Financing or BHSF, that's us, that's Medicaid. Some of our functions include Medicaid eligibility determinations, involving, income and other determinations like citizenship and immigration status and those kinds of things. We don't generally do, the Medicaid office does not generally do the programmatic determinations. And what I mean by programmatic, that's not the most precise word, but if, for instance, there is a disability pathway to a program or a service, or if a person needs to meet a certain level of care in order to receive a particular Medicaid service, those determinations are generally provided by the LDH program offices. The other major function of Medicaid is to make provider payments, to provide oversight of the managed care plans, oversight of Medicaid services. The Medicaid state plan defines all of the services that are available under Medicaid, and the Medicaid office ensures that that Medicaid state plan is accurate, and that providers are providing the services as required. And as I mentioned earlier, in partnership with the LDH program offices, we also administer the 1915C home and community-based waivers and the 1115 demonstration waivers. And let's see, Julie, the next slide when you get the chance. And I'll just mention that when we talk about waivers, the 1915C home and community-based waivers might be the ones that you all are the people in the audience are most familiar with. These are the programs that provide, in addition to basic Medicaid state plan services, provide additional services that are specifically designed to enable people with disabilities to remain in the community and living independently. 1115 waivers are programs under Medicaid that allow for particular flexibilities. We apply to the Centers for Medicare and Medicaid Services to get those flexibilities, and it's meant to allow us to kind of tailor our programs to meet the needs of our state. Medicaid has done a great deal in response to COVID-19. All of those programs that I mentioned generally come with a lot of rules and regulations, and sometimes those become impractical in the face of disaster or emergency. And so a large part of what we have done in response to COVID-19 is working with the program offices in LDH and with providers, with the MCOs to seek and to receive the appropriate authorities from CMS to implement those flexibilities that we need because of COVID-19. The page you see on your screen, the screenshot you see here is the Medicaid coronavirus page. It's got all of the Medicaid specific announcements that have gone out. It's got all of the documents that we have submitted to CMS, all of the state-based authorities we have implemented. So there's a whole variety of information there that should be helpful to you if you need some information about services. Again, guidance for members, for providers, health plan advisories, emergency rules, and submissions to CMS. When we have received them, we also post the specific approvals that we have gotten from CMS. Next slide when you're ready. So some of the COVID-specific changes that we wanted to highlight today have to do with eligibility. The Families First Coronavirus Response Act provides that Medicaid programs extend continuous eligibility through the public health emergency. There's on that web page noted on the previous slide, there's a notice about this, which is dated April 20th. And you can follow the link and see that. But essentially what this provides is that anyone who has been determined eligible for Medicaid will maintain that eligibility through the public health emergency. Generally speaking, when someone is found eligible for Medicaid, that eligibility lasts for a year. There's an annual reassessment. Some other things can trigger it, but the basic program is a year. What we have implemented and what all Medicaid offices around the country have implemented in response to coronavirus and the Families First Act is that eligibility is extended at least through the duration of the public health emergency. Now, the public health emergency will currently expire on July 25th. We do expect that it will be extended, but there has not been any official move toward that so far. And the only exceptions to this extension of eligibility exist where there's been a death or the person has permanently moved out of state or they have voluntarily relinquished their Medicaid eligibility to let us know that they no longer need Medicaid. The other major initiative in eligibility that we have implemented is coverage of COVID testing for uninsured individuals. And again, on that webpage referenced on the previous slide, you can find a notice dated May 22nd on that. And what that does is allows for any uninsured individual who is a U.S. citizen or is of an eligible immigration status, because Medicaid is restricted according to citizenship and immigration status. But any uninsured individual meeting those requirements is provided with free COVID testing, covered COVID testing. The way an individual should access this testing is to make an appointment with a doctor who provides Medicaid coverage, who is accepting Medicaid for the purposes of COVID testing. If someone needs to find a doctor who does that, they can call 211 and get doctors in their area who are participating in this program. There's a very simplified application for this. You can fill it out with the provider, or you can access it online, again, at that website, and submit it through email, through fax, or through mail. And then there's some other basic flexibilities, largely having to do with time frames, timelines and appeals, in some cases accepting self-attested information rather than documented information that will again be followed up on after the conclusion of the public health emergency. But just some flexibilities there. And then in terms of services, we've implemented some changes to allow for family members and other parties to provide services in the home where there usually are not. We've implemented telehealth flexibilities where they weren't allowed before, and there's some additional waiver service modifications that the program offices are going to get into when they speak. And that's it for me. And I think we are running a little bit short on time, so I'll close up.
Hi, everyone. So like and I will be giving a little bit of a brief overview on in response to COVID. So on the first slide, this first slide, you see that we manage and deliver services and supports that are necessary to improve the quality of life and individuals with known as behavioral health. Hence, we're the Office of Behavioral Health. The mission of LDH is to protect and promote, and of course OBH is aligned with that same mission and vision as well. Specifically, what we do is we act as monitors and subject matter consultants. Some people call them subject matter experts for but particularly one of their through the, and it's also known as the CSOC program, through the Medicaid Health in Louisiana managed care plans. Behavioral services are managed care plans. We also deliver direct care through hospitalization, and we have oversight of the behavioral health community-based treatment programs through the human services districts and authorities, are better known as the local governing entities, or LGEs. So a little bit about our primary populations, families who are by serious emotional or behavioral health issues, and this includes co-occurring disorders. Specifically, when we're talking about adolescents and adults, we help to provide programming and services for those two populations regarding substance use and addictive disorder, tobacco, and opioid use, tobacco use. Some initiatives geared around pregnant women and women with dependents. And so we have some pretty targeted grants to focus specifically on that population. We also work with and for individuals needing forensic related mental health treatment. And we have 2 state psychiatric hospitals that we manage and oversee. Some first episode psychosis programming. As I mentioned earlier, the opioid response. And so we have some things surrounding opioid recovery, treatment, maintenance of things of that nature. Several more programs, but for time's sake, I won't go through them all. So some of the COVID specific changes or modifications, some of the things that OBH is doing and has done. The first, I know you've heard a little bit about telehealth allowance, telehealth and the utilization. I know you've heard a lot of services are being delivered. So one of the things we have, since we have responded to the COVID pandemic, is that we have some mental health rehabilitation allowances. And so we've allowed telehealth services through the MHRs. We've also allowed telehealth services for outpatient SUD treatment, and SUD treatment is substance use disorder treatment. And that includes group therapy. So licensed mental health practitioners, or LMHPs, are already allowed to do telehealth, but we've allowed some flexibilities and relaxed some of the rules around how those services are provided. So we've had to do evaluation as well as some outpatient group therapy. Distributed a lot of guidance around these types of things, specifically for providers and individuals and citizens, and also some things that are geared towards parents and families. And I provided those resources on a later slide for you. The other things that we're doing, we have some COVID-19 specific grants that we are working with and working with other agencies to make sure that we have some services available and accessible to the citizens of Louisiana. One of those things is the FEMA Crisis Counseling Program grant. This year, GODA is the lead, but we are happy to be working jointly with them to provide some of the services and some of the things that we know are necessary during this time. And so some of the things that OBA services with this is our Keep Calm Through COVID line. You've probably heard about that. The governor has talked about it in his briefings, but that is a 24-hour, 7-day-a-week line that you can call at any time. It's free, it is confidential, and it is specifically for anyone experiencing distress or emotional distress related to the COVID-19 and related to the COVID-19 and also CCC and staff and other entities, excuse me, are helping to provide those services, excuse me, for those individuals and that's those staff who have been impacted by COVID-19. Another thing that comes with the excuse me, excuse me, for the is the assistance we're giving to the LGEs to help us implement these things that we're doing with this grant. We also have an emergency COVID-19 behavioral health grant that was awarded through SAMHSA, the department, but OBH, several residential COVID-19 facilities to make sure that there is access to basically the Odyssey House. We also have plans in place to provide support to the Baton Rouge General in East Baton Rouge Parish for COVID-19 residents who are So some of our other emergency response activities have recovery, and I provide that information on the following slide as well. And I've also provided a lot of the information that or reach out if you need more information about behavioral health resources and other things that could be of assistance during this COVID-19 pandemic. Next slide. Oh, and there are some available resources, and I provided them on the website. I mean, on the web page slide, but just wanted to point those things out to that along with them. There is a crisis text line now that we are helping to spread the word about. And I provided that information as well as the information about the behavioral health recovery and outreach line. We also encourage you to reach out to the local governing entities if you have any behavioral health needs or know anyone who may need some. Those services are our direct service clinics, and they will be able to provide you with assistance and information. And that concludes my presentation. I apologize.
Okay, Robin Wagner here for the Office of Aging and Adult Services. This first slide shows the programs that are managed within our office. They include 2 home and community-based waivers, Adult Day Health Care and the Community Choices Waiver. Our largest Medicaid home-based program is the Long-Term Personal Care Services, which provides personal care attendant services in the home. We also have 3 PACE sites. We manage adult protective services, 2 smaller state-funded programs, the Traumatic Head and Spinal Cord Injury Trust Fund and state-funded PCA. We also do nursing facility admissions. Anyone who enters a nursing home in Louisiana has to be approved for the clinical need for those services prior to entry. And in addition to assisting people to access nursing homes, we also assist people to transition out of nursing homes through a couple of different transition programs. Our office also manages the Permanent Supportive Housing Program, which provides affordable housing to people with any type of disability, at the same time providing the tenancy supports to help them be successful tenants. We can go to our next slide. So among those community-based services, personal care attendant services are probably the most often used service for our clientele. And I should mention that our clientele, the people that we serve, are older adults and people who acquire disability after the age of 21. So people with disabilities acquired in adulthood, the majority of whom are older adults. So personal care attendant service is the most oft-used service, but this whole list of services are the things that exist within our most comprehensive home and community-based waiver, the Community Choices Waiver. And among these services, home modifications for accessibility are often used by people. We offer a wide range of assistive devices and technology, including remote sensor monitoring, which is something that we're trying to make more use of now during the public health emergency, home delivered meals, transition supports, and a variety of different approaches to service to assist people. I'm moving along quickly here because I want to get to the COVID-related stuff and make sure that Julie has time to speak for OCDD as well. So the major things that we've had to do within OAES in response to the public health emergency, First step was that we had to close down our center-based services. That's both within adult day healthcare and in our PACE programs. Now, our PACE programs were able to continue their clinical services and their care coordination. PACE arranges their participants' total package of medical services. So they're continuing to do that work. But adult day healthcare, which is highly based in center-delivered services, has really had to close down those centers and change what they're doing in very dramatic ways. And they also have lost their billing mechanism under Medicaid. So in addition to closing those services for safety purposes, we've also had to look at how do we keep them financially solvent so that when the public health emergency ends, we still have that set of home and community-based services to offer people. So because of that, we have made retainer payments to adult day healthcare centers, and we are also in the process of putting in place payment mechanisms that will allow them to deliver telehealth to their participants and follow up with in-home support such as meal delivery, medication management, et cetera, when that is warranted. Many of the centers have been staying in touch with their participants in these ways already. We're going to set up mechanisms so that they can bill for those activities. In addition to that, we automatically increased the personal care allowance for our ADHD recipients who are receiving PCA services. We added home delivered meals and remote sensor monitoring to those waivers. So that's one set of things that we did around our center-based services. The other thing that we did pretty immediately is we wanted to assure that our home-based services were still being delivered. So in addition to providing guidance to our home-based provider network about how their workers are considered essential healthcare employees, and that while wanting them to take precautions, we needed them to continue to deliver these essential services. We also implemented flexibilities that would allow people to use a family member that they might not ordinarily be able to use as their worker, allowing them to live with their workers, which are arrangements that sometimes are not approved under regular circumstances. In addition to those flexibilities, we pursued hazard pay. We have not been able to implement that yet, but we would like to and still hope to implement hazard pay for personal care attendant workers who are working with people who have confirmed or suspected COVID. And then another important thing that we did is monitor that services were still being delivered. So our support coordinators have been actively calling people on a regular basis to get information about their COVID status for one, but also to make sure that their workers still coming into the home. And I cannot say kudos enough to our provider network because they have continued to deliver services under these very difficult circumstances. We have very, very few reports of workers not showing up due to concerns about COVID. We have seen issues with our recipients not wanting to have workers during this period. That's a different issue when it's a decision that they're making for themselves. And finally, we are making efforts to expand our use of remote sensor monitoring. A third area is that we have reduced face-to-face contact when necessary. We are able to extend people's plans of care and their service authorizations without having to have face-to-face reassessments with them. We are using telephones and other technology when we feel it's helpful to make adjustments to people's plans of care and where that's possible. And in light of all of this, you know, one of the things that I wanted to provide in kind of the global perspective is that intake has been impacted. So in the midst of this, we haven't been able to do, because so many of our intake processes involve face-to-face assessments, we have not had as many new people coming into programs like our LTPCS program. We are looking at ways of implementing alternative assessment systems to be able to resume intake back to previous levels. We're in the process of doing that. And I should also mention that one area where we have not reduced activities is in nursing facility transitions and diversions. We are continuing to house people in our permanent supportive housing program with a special emphasis on diverting homeless individuals who might otherwise wind up in nursing homes. And we have also continued our nursing facility transitions, which has seemed really important at this time when infections in nursing homes have been such an issue. There have been challenges around that, but we felt it was important to continue. Those are kind of the highlights of what I wanted to touch upon. I think on the next slide, there are a couple of websites for OAAS where you can go and get more detailed information about the flexibilities that we've implemented in our response to COVID. Thank you. Julie, you're up next.
Bambi, Julie mentioned that she had some issues with the audio. Maybe, oh, there she is.
Yeah, I'm receiving a message that Julie is not audible.
Can she call in?
Well, wait. I believe she has. Now, I can take Karen Scallon's question while we're waiting for Julie to join, but I want to let her know that we are having those issues. So I have a question in the chat box from Karen Scallon about asking to speak more about remote sensor monitoring. How would someone access that service? They would let their support coordinator know that they want to have that service added to their plan of care. A second question from Karen is what ADHD services are available through telehealth? We are going to be requesting that ADHD providers maintain daily telephone contact with participants where they assess for status changes and needs, and then follow up if needed with meal delivery, with delivery of supplies and medical supplies, and because they have nurses on staff, medical monitoring or assistance with medication administration, and also personal care attendant services in the home if that's warranted.
Julie, can you try?
Are you guys able to hear me now?
Yes.
Okay. Sorry about that. I'm not sure what happened. So I will quickly move on. I know we are down to about 3 minutes. We had hoped to have some time for questions, but you guys do have all of our contact information. And if you have follow-up questions, feel free to reach out to us after the presentation. So this just tells you, most folks are familiar with our Office for Citizens with Developmental Disabilities and what we do. We do have similar waiver programs to what Robin was sharing with you. The Early Steps program is also under our office. And then we have statewide resource center staff and some state-funded services that we work directly with our local governing entities on. And we do have some programmatic oversight of the intermediate care facilities. There are 2 state-operated intermediate care facilities that remain in Louisiana. That's Pinecrest Supports and Services Center and Central Louisiana Supports and Services Center. That used to be called Louisiana Special Education, but in January it moved under the Department of Health, and we changed the name of it to the Central Louisiana Supports and Services Center. As Robin said, we have many variety of services within our home and community-based waivers, and just tried to give you guys a little bit of an idea of what some of those different services are that we have available through those waivers. Some of the COVID-specific changes or modifications I have listed here. The one that we've seen folks use mostly are allowing the the legally responsible relatives to be paid direct support staff. And we did that directly to be able to help people who weren't comfortable having direct support staff in and out of their home. We've also done, looked at not having background checks for those immediate family members. And then, you know, similar to what Robin was mentioning about the adult day healthcare centers, all of our day programs are under a mandatory closure at this point as well. So for those folks who maybe needed assistance, personal care assistance, we did convert some hours so that they would be able to get that service in home while our day habilitation programs remain closure. We also have had a few other changes, again, that are all listed here. And one of the things that we are doing is scheduling some listening sessions with some family members, individuals receiving services, and providers. I don't have the details on that yet, but I can make sure to get it out to Bambi when we do, so that we can talk about as we start to return and have places where we need to start to think about coming back, which we're not really ready to do yet, especially as we continue to have more cases, as other people have talked about. But what will that look like, and what will we be able to do? And also to share with folks, because we've had a lot of folks ask us to continue some of our exceptions, and there are some that we could consider some alternative to, but there are others that, because of federal rules and regulations, we would not be able to continue it post-COVID. So I will make sure that I continue to share that information with Bambi for any of you who might be interested in having those conversations and being part of those listening sessions with us. So there's my information as well as some links, and I think we are 1 minute over, so I will stop there, Bambi, and turn it back over to you guys.
Thank you so much. I did a great job. I know that was a short session and jam-packed with information. We do have the PowerPoint. We received the PowerPoint that you sent, and we can send that out as a PDF to our participants or the people who registered, so you can have access to those links that were shown throughout the PowerPoint. So right now what we're going to do is stop the session right now, just take a few minute break. We'll come back at 2 o'clock for our session on emergency preparedness, and we'll keep it's COVID and hurricane COVID and hurricane season emergency preparedness for families with disabilities. Very important and timely topic. You can keep streaming through YouTube, or if you're on Zoom, you can continue there. We'll be back at 2 o'clock. Thank you. And thank all of you ladies from Department of Health.